طبعا I'll speak in English just in case إن في أحد ما يعني عشان يكون نضمن الجميع يفهم. I'll speak with English for the rest of the presentation. Today I was asked by some of your colleagues في جامعة القصيم to speak about neurology in general, residency and as a specialty. So today we'll go through neurology in very basic terms. What is neurology? What do we do? What are the advancements in the past few years? What is it as a career? And what is the neurology residency program? An overview about the residency programs in Riyadh. طبعا I'll focus only in Riyadh, Saudi Arabia, because for the residency abroad it needs different lectures. And it's very extensive with different requirements, but we'll focus on the main programs, which is in Riyadh. So as I mentioned, we'll talk about neurology, then we'll talk about some tips about acceptance and some advices about how to excel in the residency. And then we'll take your questions at the end. As most of you know, since you are medical students / medical interns, so this is very basic information. But still, neurology is one of the most underrated specialties in medical school. We are not exposed to it as much. We are not updated because many of those doctors, they are non-neurologists talking about neurology, especially in the basic science. So maybe it's overlooked as a specialty frequently. So neurologists are those doctors, medical doctors, not surgeons, that will treat various diseases and conditions affecting the brain, spinal cord, going to the peripheral system, BNS, which is peripheral nerves, cranial nerves, neuromuscular junctions, and muscles as well. So these are the organs in which we are responsible of. One of the things about neurology, it's one of the few specialties that remain clinical, despite a lot of advancements in the past few decades or the past few years, with a very advanced testing and and imaging as well. We are still the specialty that requires very good clinical examination, clinical assessment, history, and exam, as it will change a lot in the plan, in the management, and other things. And those of you who have taken rotations in neurology in one of the main centers, you will notice that we spend time with the patient more than any other specialty. So we are a clinical specialty for those who like to do this. One of the things as well, actually one of the reasons that the neurology is overlooked because it's rapidly growing, and if you don't have a specialist or neurologist, you may not be aware about the new changes. So we are a rapidly growing specialty. New data have changed over the past few years, have changed the standard of care for a lot of diseases such as stroke or multiple sclerosis and other things. New things emerging, new medications, and new guidelines as well, changing significantly the standard of care. So these are one of the exciting things about neurology. It's a rapidly growing specialty, and still we have a lot of things to be done, inshallah, in the next few years. And it's expected that we have more advancements as well in how we treat and how we diagnose and how we treat patients. And also we have a lot of subspecialties. Neurology is becoming like a separate entity, not under internal medicine. Previously, neurology is thought to be one of the subspecialties under internal medicine. Now it's a very big umbrella. It's not under internal medicine. It's an umbrella of its own, with a lot of subspecialties under neurology, and you will see in the next few slides. So that's one of the things as well. You will see in many hospitals, including King Faisal Specialist Hospital and in our hospital as well, it's becoming a department of its own, meaning that it's only a separate entity already. So we have a residency training program available locally, excellent and strong programs in the Saudi board locally, Riyadh. And of course, we have abroad in all countries, almost all countries, but the famous ones is in North America, such as America, USA, and Canada. So these are the most of the subspecialties in neurology, some of which are very deficient in Saudi Arabia. Some of them are more common. We have the vascular neurology, which is the stroke. We have the epilepsy and any related disorders, neuromuscular. We have also the autoimmune neurology, which is a specialty by its own, and we have neuroimmunology, which is more focused on MS and demyelinating disease. And neuroinfectious as well, which is usually related. Many people take fellowship neuroinfectious with neuroimmunology. Movement disorders, treating diseases such as Parkinson's disease and other related disorders, cognitive neurology, treating patients with Alzheimer's disease and other dementia syndromes. With a lot of advancement as well in cognitive neurology in the past few years. Neuro-ophthalmology, we have only, I think, a couple of consultants in Saudi Arabia. One of them is in our center, Curve Care, but not much. يعني in Saudi Arabia, we have only few consultants, like four, I think 3 to 4 consultants only. We have neuro-oncology, we have only one consultant in Saudi Arabia. I think two. There may be someone else in King Saudi University, but what I know صراحة is one only. So 1 to 2 only in Saudi Arabia, very deficient. Autonomic medicine, also not a lot of people doing it. We have neurointervention, which is usually related to stroke. People continue to training after stroke in the fellowship to do the interventional work like thrombectomies and other related disorders, other related procedures. That's neurointerventional. We have also a couple of consultants here in Saudi Arabia. We have Dr. Fahmi Snani, one of the famous one, Dr. Al Hazzani in King Faisal, Dr. Fahmi Snani in King Fahd Medical City, and Dr. Hazzani is on King Faisal Specialist Hospital. I think we have Dr. Ramehi. I think Dr. Ramehi is in King Saud University. He's also a neurointerventionist. And headache disorders, which is, I think we have only two headache specialists in Saudi Arabia. And finally, neurocritical, which is an ICU, basically. Further training will be in neurocritical conditions and an ICU setting. So as you mentioned, there's a lot of options, many of which still not very deficient, especially outside Riyadh. And also in Riyadh, we have only few consultants in many specialties. So still, they are deficient in those. And it's really growing year after year. So, for the residency programs, the program was established in 1995. It was initially a 4-year program following the USA system. Later on, in 2016, a 5th year was added, and now it's 5-year program. And we are only the only medical specialty with a 5-year program. The other specialties are surgical ones, which with 5-year, 6-year, or 7-year programs. But we are only the only medical specialty with 5-year program. So we'll talk about the rotations the next slide, inshallah. طبعا the 5-year is following the Canadian system. It's similar to the Canadian system. So these are the updated rotation. It was updated in the last 2 years. The rota, the master rota. You can see from the here. I'm not sure if you see the cursor. We have here the R1, R2, R3, R4, and R5. So the R1, the majority of it are internal medicine, ICU, neurosurgery, and psychiatry, but little of neurology. From R2, you will start to be a neurology resident, practice-wise. With most of the rotation, R2 are direct to neurology service, inpatient, stroke, consultation to have the maximum exposure. And then in the R3, you will have some specialized services such as pediatric neurology, EEG, and EMG. And in R4, most of it will be services in which you will practice as a senior, okay, in addition to one EMG and EEG. And in the last year, most of it will be specialized clinic. Because you are on R5 only, you are very selective in what you do. So clinic, the majority of the rotations are clinic, almost 50% are clinics. And you're going to have 2 electives and leave as well because you need time to maybe study to the exam or have electives outside to figure out what you want after residency. Because in this year you will study for the exam, the board exam. In R2, you will be studying for the part 1. So we have part 1 exam in R2. You can take it also in R1 or R3. It's all options, but most of people do it at R2. It's the best time. And we have the board in R5. And each year you have promotion exam. You are excused from the promotion in R2 because you're taking the part 1 exam. So no, you don't need to take a promotion. And of course in R5 because you're taking the board already. And again, sorry, before I move on, in R1, you are not required to take the promotion exam. No need for that. طيب, so for the programs in Saudi Arabia, so I will talk about the main programs. So the well-established ones are in Riyadh, most of them, and we have a handful of programs, excellent ones. So we have King Blaze Medical City, which is my the hospital where I work, and King Faisal Specialist Hospital, King Fahd Medical City. طبعا بالعربي هذا الحرس أول واحد، كينج بلايز ميديكال سيتي الحرس، كينج فيصل سبيشالست هوسبيتال تخصصي، كينج فهد ميديكال سيتي اللي هي المدينة، يسمونها المدينة. كينج سعود يونيفرسيتي ميديكال سيتي this is الجامعي. كينج سعود ميديكال سيتي this is الشميسي. and كينج برنس سلطان ميلتري هوسبيتال this is العسكري. and finally security forces hospital this is قوة الأمن. Okay. So after residency, we have some fellowships. No need to focus on those. This is just يعني for overview. We have also fellowships in Saudi Arabia. A few neurophysiology, stroke, epilepsy, movement in تخصصي and King Fahd, and neurology newly established in التخصصي and soon in الحرس إن شاء الله. So for the requirement for the program, I think most of you know that it's really something common knowledge that you need a bachelor degree in medicine in Saudi Arabia or other recognized universities abroad, MBBS or MD. We need to you need to complete your internship year training, or at least to have a document saying that you already are doing it يعني doing applications. الأكاديميك ريكورد هالشيء something you can get from your university. Okay, اللي transcript academic transcript from the university. You need to be medically fit because you will do a lot of testing before you start any rotation in any hospital. They ask you for a medical checkup, so you need to be fit to continue your rotations even. And of course, you need to pass the Saudi Council exam, the one you do in the internship or in the last year of your medical school journey, or in the internship year. Okay, and it will be valid for 5 years. Of course, your focus will not be on passing the exam, actually in doing a good score to get an acceptance later. So, but this is a requirement. You cannot apply even without passing. You need to pass. طيب, so how to get, أكيد this is one of the common questions we get, how to get accepted, what should I do to get accepted? A lot of questions. I think the answer is usually circulating around these concepts. So in order for a center to accept you, one of the things you need to do is to try to take rotations with them. So nobody like accepting people without knowing them. This is a common sense, right? So I need to know this person, how is he, how he deals with patient, with colleagues, and other things, how he deal with problems. So if I know this person worked with me, I know he's excellent, I will be more comfortable accepting this person. Okay. So taking rotations is important. Try to do so. And it's better to do it in the golden months. So my golden months is really a name we gave to those months, which is close to the interviews, because they will remember you if you take in the golden months. We are talking about December, January, February, or even March before Ramadan. So those months are really good because it's close to the interviews. But really, it's not يعني mandatory, because if you are excellent, and believe me, if you are very excellent, and you talk even in October or in November, people will remember you. Resident will remember you, and they will يعني say your name in the forms. When we send forms to the resident, please recommend good interns, or in the meetings, for example. Those who are excellent will not be forgotten. Okay, they will be mentioned. Their names will come up. So it's better, but not really a very mandatory thing. Okay. So other things other than making a good impression, طبعا not only taking a rotation in the golden months, you need to take them and leave a good impression. So good impression meaning that you are you are liked by the team you are with, meaning that you are punctual, you are respectful, okay, you are able to do the job, suitable for the job, okay. So you need to leave a good impression. We can talk about that in the questions later if you have specific questions, but it's really logical for me just to be like punctual and respect your colleagues and work hard, ask for responsibilities, And basically, it's as simple as that. The attitude is the most important thing. It's not like the knowledge. If you don't know a lot of things, it's okay, but it's not okay if you have a bad attitude. If you have a very poor attitude or not punctual or any of those red flags, your name will be crossed immediately, even though you are really a genius. Okay, and I'm not talking theoretically. We had people who are their CV is very impressive, but they were crossed immediately because of their attitude. Okay, so the attitude, personality is the most important thing. It means that you are able to grow or to improve if you have good attitude. But if you don't, you'll cause problems. You will be dangerous to patients. You will be disrespectful to colleagues, and nobody will يعني, take a risk of accepting such a person or a resident. And finally, the CV. طبعا CV, a lot of questions we get about how many research, how many. There is no guidelines about this. There is no specific number you need. Your CV should align with your application. That's as simple as it gets. So you are applying the neurology. Your CV has to say that this person actually likes neurology and he wants to have a neurology as a career. Your CV should say that. Basically, if you have two research only or one published good and you have a lot of volunteering experiences, some of ongoing researches in neurology and some of your volunteering or campaigns related to neurology, and you have a lot of recommendation letters from consultants, neurology consultant, that has it settles it. You clearly this is the path you want, but there is no specific number for any of these things. أهم شيء your research shows that you want neurology. And the more the better. يعني try to do more things. Try to يعني في the reflective يعني the interest is one thing in CV. There are other things in CV that says a lot about you. For example, if someone their CV they did a good number of volunteering campaigns. Some they did extracurricular activities in the college, the college, the students club and other things. It gives an impression to anyone that this person is proactive. Work he likes to work, he likes to improve. He's a proactive person. فthis is a good sign. خلاص, as opposed to someone who did not do anything extracurricular, who's only doing research and have a good grades. So try to have a CV that reflects good information about you. That's all I can say. But there is no specific number. Anyone who tells you you have to have this or this, it's not an accurate information. It depends on the center and the consultant who's interviewing you. But that's the general thing that you need to know. Okay. So, going to the residency itself, um, so a resident doctor is a demanding job. It's not an easy one. Okay, it's one of the most demanding job I believe ever. طيب, you have a huge responsibility. خلاص, you are dealing with patients, sick patients. You have to take decisions sometimes, especially if you had a senior one, and you are taking on calls as a senior. You are alone in the hospital, so you need to take decisions that are not easy. You have يعني working hours is insane. Okay, when we compare it to the rest of the jobs, so high working hours. In addition to that, it's not only a static job, a job in which you need to improve, constantly improve. You are moving from junior to senior. R2, your knowledge or your skills as R2 should not be the same in R3. Same thing to R4, and so on and so forth. So, aligning with the demanding nature of this job, you need to read and improve. Okay. So that's another thing. So in order to succeed, you need to have a good time management. You can't do it all. You can. If the question is as simple as can we do it? Yes, you can. It's difficult. It's very demanding, but you can do it. You can manage your time. You can be an excellent resident, and you can read a good amount. Yeah, and if you are organized, you can read regularly. Something you can do if you are organized and dedicated. And one of the things that it will kill the progress of any resident if he doesn't read unless there is an exam. So this is very devastating thing you will do to yourself if you only read for exam. This is in medical school only. So in medical school, you have a very packed schedule. You are basically reading for exam. You have very packed schedule. In 4 weeks, you're gonna have midterm or 2 weeks, and then after a couple of weeks more, you're gonna have your final in the block and OSCE and so on. So you are basically doing this frequently in very tight timeline. But in residency, it's different. It's a year, a whole year, and you will have examination only once, the end of the year. So if you read only for exams, you will be doing the minimum, and this will reflect on your performance. So you need to read continuously to be an excellent resident in your specialty. This does not any it's not true only for neurology. It's for all specialties, a residency in general. Okay. And the last thing is you need to maintain a life outside the workplace. This is important. Some people say this is not very important, but I'm telling you, it's a mandatory thing to do because residency in neurology it's 5 years, in other specialties 6 years, and I am 4 years, so it's a long time of your life. Okay, if you don't maintain a life outside, you will be burned out. You will lose a lot of things. You will lose yourself if you don't, if you only do things related to residency and only inside the hospital. So because it's a long time, 4, 5 years, 6 years, so you need to find a balance. Okay, it will eventually reflect on your performance because if you do it well, you will have better. You will not be burned out. Your mental health will be better to give back and to improve. So I think this is the last slide. So some people ask why did you choose neurology or why should I go to neurology? It's not something that I should convince you with. I'm just giving you facts. What makes neurology different from some other specialties? So basically, neurology is a clinical specialty where we depend a lot in neuroscience, okay, neuroanatomy, and the basics of neurophysiology. Okay, we without understanding this, we can move to clinical. So that's one thing. Some people like this. So some of us think about this as advantage or disadvantage, depends on your perspective. And as I mentioned in the first slide, it's a clinician role, as opposed to other specialty where they depend on advanced testing and imaging. And this is يعني ممكن cliché a little bit بس in the movies and medical movies, but it's partially true. If you like puzzles and mysteries, neurology is a good choice because there are a lot of unknown things and strange things you see. So it is still an interesting specialty to work in if you like these things, if you like mysteries and difficult cases, because there are a lot of cases that we don't know really. It's there are a lot of things in neurology that we still don't know. So that's thing you keep it in mind about neurology. And as I also gave a glance about this in the first few slides, there is life-changing therapies, such as, for example, in the past 10 years, advancement in strokes like TBA, and there are more studies about TBA and thrombectomy, especially TBA coming up, but thrombectomy, a lot of advancement in thrombectomy, which changed uh, the outcome of many patients. Okay, and those who took rotations in main centers, maybe you have seen this already. So that's one thing, that we have a life-changing therapy in the past 2 decades, and inshallah more to come. So it's a very dynamic specialty. If you like dynamic things and continuously changing specialties, and neurology is, I think it's within that any window. It's a really very evolving specialty. And lastly, we have clinical exposure that is diverse. We see outpatient and mainly outpatient. We have inpatient service. We see, and we have a lot of admissions, stroke, non-stroke. We have also a lot of ER, acute neurology cases. So if you like a mixture of these, also neurology will give you that experience. if you like to do inpatient hospital يعني hospitalist job, taking care of patients who are hospitalized, you'll find a lot in neurology. And in ER, we have acute neurology cases such as meningitis, status epilepticus, and headaches, and others. Okay, so that's one thing. And outpatient, all of our patients يعني fall within the outpatient any window. We see them as outpatient. Many of our diseases and conditions diagnosed and treated as outpatient basis. So all of these exposures you will have as a neurology resident or a neurologist. So this is the last slide. I hope يعني I gave كذا a good introduction about it. إن شاء الله يعني you will think about it. And if you have any questions, you can ask now. And also later, you have my information, my email, my X account, and Telegram. You can reach me at any time. السلام. لا تبع البيدياتريك. يعني ما أقصد ما أقصد ما لها، أنت قصدك إنه أندر نيورولوجي يعني؟ لا لا هو ريزدنسي لوحده. في ناس ياخذونه من البيدياتريك وبس، الآن هو ريزدنسي سيبريتد ريزدنسي الحالة. هي أدلت نيورولوجي صحيح. فهل these questions أنا صراحة ما أحس إن الأفضل الواحد يجاوبها عنك. You need to go and see patients. خذ rotation in a main center. الحرس تخصصي whatever. Take a rotation هناك و see how things are being done هناك. خلاص. لكن in general زي ما ذكرت في البرزنتيشن النيورولوجي are very dynamic specialties. A lot of things are changing. زين في life changing therapies, but still poor outcome can happen. It's a hospital. We have sick patients. We have patients who do not improve. Okay, patients who die. We have patients on the other hand who improve. It's difficult to say one answer. ما بي أظل لك. You need to see with yourself. But there are patients who improve. فيها a lot of changing in the past few years. تغيرت أشياء كثيرة. New therapies emerged that changed dramatically changed the outcome of many patients, especially in stroke, epilepsy, multiple sclerosis. كلها قبل 10 سنوات كان الوضع مختلف تماما. حتى الكتب اللي 2015 كذا خلاص it's old, we don't read it. It's outdated. A lot of things changed in the past few years. But again, I don't like answering these questions لأنها مهمة مرة و it might change your path. So you have to see with yourself قبل ما تحكم. الله يعافيك. بروسيجرز احنا طبعا في على حسب في الريزدنسي يعني احنا نسوي اللمبر بنكتشر هذه مينلي ذا بروسيجر. بت نيورولوجيست ان جنرال في اكثر من بروسيجر انت تسويها ديبندنج على يور كومفورت. يعني انت ايش تبغى بالضبط. يعني في عندنا غير اللمبر بنكتشر وي هاف اللي هو البوتوكس نيرف بلوكس تسوى. ايش بعد البوتوكس والنيرف بلوكس ان جنرال. وفي اذا تاخذ فيلوشيب في النيورو انترفنشنال تديك تسوي ثرومبكتوميز واي شيء فاسكر تسوي اذا اخذت نيورو انترفنشنال فيلوشيب. بس غير كذا يعني ذاتس ات يعني ما في شيء ثاني. ايش قصدك يعني اي سب سبيشاليتي؟ انت جنرال نيورولوجيست في الاخير اذا اخذت البورد انت جنرال نيورولوجيست. الفيلوشيب از ان اديشن. عاد وش تعالج هذا يعتمد على المستشفى اللي تشتغل فيه. اذا هو يعني فيري سب سبيشاليزد هوسبيتال بيخليك بس تعالج يور سب سبيشاليتي كان بها. بس اذا ما كان فيري سب سبيشاليزد تتعامل مع كل شيء. يو ار جنرال نيورولوجيست قبل ما تكون سب سبيشاليست شيء معين. تمام. فهو يعتمد على المستشفى اللي تشتغل فيه. احنا في السعوديه ما عندنا هذا اللكجري للامانه الى الان. يعني يمكن تخصصي هو اللي فيري سب سبيشاليزد ممكن انك فاهم شوي. but otherwise other hospital including الحرس you will work as a general neurologist. عادي يعني كلها. اللي ذكرتها هي المين سنترز اللي ذكرتها في البداية، هذه الخمسة أو الستة. هي اللي البداية يعني الحرس تخصصي الملك فهد العسكري، هذه هي المين سنتر. هي اللي ممكن تاخذ فيها وتشوف النيورولوجي زين يعني with good exposure. لكن which one is better هذه debate صراحة your preference. أنت الأفضل الأوبتيمال ثينج إنك تاخذ فيهم كلهم، أو اثنين ثلاثة منهم وتشوف. ما له دخل ضابط، هذا شيء ثاني، تصير زي الباقيين مدني عادي. الضابط هذا شيء ثاني، تقدم عليه بوابة مختلفة ولهم قبول مختلف. ما له علاقة يعني، حتى اللي مقدم في العسكري يقدر يقدم على وزارة الحرس الوطني كضابط، لها بوابة مختلفة وشيء مختلف تماما. قل لي يا هبل، أنا يبي لي دقيقة بس لازم وش هي السؤالين؟ الاكسبتنس يعني هذا الاخير زي ما نقول قبل كل شيء، هذه ارزاق بيد الله يعني، ما في شيء معين. لكن انت تزيد فرصك انك تاخذ. بس في ناس قبلوا وما اخذوا عندنا من قبل، السنه هذه والسنه اللي قبل. يعتمد يعني، والله يعتمد على السيتويشن. يعتمد على يمكن ما في اذر ابليكنتس كويسين وانت مثلا كنت فيري كونفينسنج، السي في حقتك كويسه، they liked you في الانترفيو، كنت كويس مره ويو سيم جود فارتاحوا انهم ياخذونك. فيعني الصعب تعطي انسر بالضبط او تعطي رقم what are the chances. الشانسز يعني هي بيد رب العالمين في النهايه، لكن الفكره انك you increase your chances significantly اذا السنتر عرفك قبل ما تقدم، which is a logical thing. ما في قاعده تقول ما ينقبل، هو ما في شيء اسمه ما ينقبل إذا ما اخذت عندنا. could be accepted، ينقبل عادي، ممكن ينقبل. لكن انت تزيد فرصتك اذا اخذت في السنتر، لان الناس يصيرون يعرفونك. تمام، فهذه هي الفكره. السنتر طبعا التيتشنج المشكله انها فاريبل، لانه يعتمد من اللي معك في التيم وقتها. يمكن تجي، يمكن اقول لك والله الحرس ممتازين في التيتشنج، وتجي في روتيشن يكون مثلا اللي مغطي معهم ما هو مره مهتمين، فيمكن ما يسوي، فيختلف على حسب الريزدنت. لكن ان جنرال السنترز الكبيره هذه اذا رحت لها بيكون في تيتشنج جود اكسبوجر، اللي هي الحرس والتخصصي والملك فهد والعسكري. انا هذا الاربعه هذولي اشوفهم ذي ار خلينا نقول الافضل، with some variation وايجابيات وسلبيات في كل واحد. لكنهم they are يعني the best in terms of exposure ويعني variety of cases وكذا. فممكن هذول الاربعه اي واحد منهم اذا حصلك الفرصه تروحهم، واذا قدرت اكثر من واحد الافضل تجرب اكثر من شيء. الموضوع الفرش معقد شوي يعني. انت تتكلم يو كان ابلاي اوف كورس، يو كان ابلاي از فولوشيب عادي يعني. انت تقدم برا، بس المين سنتر شيء ثاني. قصدك ان المين سنتر انت قصدك وظيفه في المين سنتر. الوظيفه هذا شيء ثاني، هذا بوزيشن، اتس ا جوب. either they offer you a job or not. فشيء ثاني انك تقدم از تريننج اوتسايد، تقدر تقدم عن طريق وزارة الصحة بوابتهم، عفوا وزارة التعليم معليش، بوابتهم تقدم فيها على فيلوشيب اوتسايد ويقدر يجيك اكسبتنس، خاصة في كندا اتس يعني ممكن ايزير. لكن انك تكمل بعدها في السنتر هذا لازم يكون عندك اكسبتنس من قبل. يعني انت هذول الناس الحرس مثلا او تخصصي خلاص وقعت معهم عقد، هذا عقد جديد يعني اتس ا جوب بوزيشن، تطلع وترجع لهم ثانية، وهم ذي سبونسر اذا طلعت، فهذا شيء ثاني. خلاص هذا يعتمد على اذا هم بيعطونك بوزيشن ولا لا بعدين. الانكولات والعمل فاريبل من سنتر لسنتر، لان اللود يحكم هذا الموضوع. لما واحد يتكلم من تخصصي غير لما واحد يتكلم من الحرس، لان في فرق في اللود. اللود از فيري هاي في الحرس، فيري هاي في العسكري. أقل في التخصصي مثلا، فيختلف طبيعة العمل اليومي عندهم. خلاص، وعدد الكيس اللي يشوفونها. الدوام هو دوام الحكومي العادي من 8 إلى 5، نفس الباقيين. خلاص. اللود از هاي، عندنا هاي في العسكري، أقل في التخصصي. فإتس فاريبل، يعتمد اللود، عدد البيشت اللي تشوفهم، عدد البيشت المنومين، يختلف من سنتر لسنتر ديبندنج على اللود. خلاص. لكن عدد ساعات الدوام هي أجريد عليها يعني، من 8 ل 5، من 7 إلى 4 في وزارة الصحة، الملك فهد يعني. لكن اذروايز نفس عدد الساعات بيسكلي. تمام. من ناحيه كان سؤال ثاني، نوعيه الكيس اللي يشوفها ولا ايش؟ والانكولات، صح؟ اي، الانكولات اجين على حسب عدد الريزيدنت. يعني كل هذه الاشياء فاريبل مره، صعب اعطيك اجابه واحده. بس يعني احنا مثلا الافرج حقنا ياخذ الشخص من 4 الى 5 انكولات في الشهر. في بير بلوك 4 اسابيع، ياخذ 4 الى 5 انكولات. sometimes more sometimes less depending على عدد الريزدنت المتوفرين في هذاك الشهر. تمام. لكن يعني يختلف في بعض السنترز، ممكن يكون العدد فيه ديفشنسي في عدد الريزدنت، فيكون العدد أكثر من كذا. خلاص. بس الهيئة تقول لك إن الماكسيموم تقريبا 7. خلاص، تقريبا لو تحسبها في 4 أسابيع، الماكسيموم بيكون 7 بير بلوك. هذا بير الهيئة يعني. من ناحية الحالات تشوفها يعني، الحالات منوعة في النيورولوجي، هذه من الأشياء الميزات. بس إن نشوف ستروك والإبيليبسي is the most تقريبا common thing followed by الام اس والنيورو immunology related disorders تكون الثالثة. بس يعني هذه الأشياء most common stroke epilepsy is the most common. كويس. اكسبوجر العسكري فيري هاي، اللود حقهم فيري عالي مرة يعني، فيري هاي. يمكن أكثر من الحرس بشوي. فالاكسبوجر عندهم مره مره عالي. طيب بس ممكنهم لس الستراكشر حقهم شويه يحتاج تطوير اكثر، لكنهم ممتازين من ناحيه الاكسبوجر، عالي جدا في العسكري. القبول في العسكري لا، ما مو بلازم، عادي. اذا عندك انت سبونسر او ايفاد، هذه اضافه لك انت. يعني هذا يسهل قبولك، انك انت انسان جاي جاهز، عندك سبونسر، يدفعوا لك راتبك كل شيء. فانت سهل قبولك في اي سنتر اذا عندك سبونسر. لكن اذا ما عندك، هم يسوون سبونسر للرزد حقينهم العسكري. حتى الحرس نفس الشيء. عفوا، واجبنا، الله يسلمك. بالتوفيق إن شاء الله جميعا.